From 11:59 Sunday night, last night, Auckland moved into alert level 3 and the rest of New Zealand moved into level 3 for 3 days until midnight Wednesday. The move was announced by Prime Minister Jacinda Ardern after 3 members of a family living in the South Auckland suburb of Papatoetoe tested positive for COVID-19. This morning, we talk with Dr. Debbie Ryan, who is the principal of Pacific Perspectives, a specialist policy and research agency that has helped coordinate and support the Ministry of Health to set up a specialist Pacific COVID-19 response team. Dr. Debbie Ryan is on the line with us now to remind us all of the responsibilities we have, as well as what level 3 means for those of us in Auckland and level 2 for the rest of us outside of Auckland. Talok Falava, Dr. Ryan, thank you so much for joining us this morning.
Thank you for the invitation to be part of your program.
Now, Auckland is at alert level 3, the rest of us alert level 2. I guess the advice is, and the experience is, we have been here before.
Yes, absolutely. And I was just thinking it's been a few months since I got to chat to you, but we all know what needs to happen here. Government has moved very quickly into level 3 because of the things we are learning from overseas. And as you have highlighted in your news item, because we don't know where this infection came from, that the mother and daughter don't have a direct connection to any known case, and they've been out in the community, the ministry is moving very quickly to put this lockdown in place so that we can get control of the virus.
Now, the virus, as the Prime Minister has been has stressed many times, it is it's a tricky virus, rather. Why is it tricky?
Yes, this is normal behavior for viruses, actually. As we all know, every year the influenza virus changes and we get new kinds of vaccines. So we are not surprised that COVID-19 is behaving in this way. The issue for us is we've never seen it before, and we've been listening to these news items and reports from countries like the UK, where these variants, as we call them, so they're just different types of the same virus, but they seem to spread much faster and more quickly than the ones that we've dealt with before. So essentially the same virus, but it has these kinds of different behaviors. So our scientists are keeping up. As the virus is changing, we're learning about it all the time as well.
The other tricky thing about viruses, I guess, also is that you can catch them but not have any symptoms for a day or two, which means you're wandering around thinking you're absolutely fine, and that makes it dangerous for everybody else.
Yes, and this tricky is actually a really good term for this virus because, as you say, some people get it and become very sick very quickly. Others can walk around and not have any symptoms. And when we listen to the stories about this case, there were some family members who have been very close contacts who are showing no symptoms, but there are other family members who are symptomatic. So it is a reminder to us that actually government and we all have worked out what to do here. The things that work are at level 3, you stay in your bubble, and we make our bubble small. So this is just close families or caregivers. We work from home if possible. The numbers of businesses that are open are much fewer, so only supermarkets, chemists, click and collect. Health clinics are now virtual, so no contact consultations, except if you have an urgent medical problem, and really want to emphasize if you have things like chest pain or problems with breathing, do not delay. You must go and see your health professional, but important, ring first. Ring your GP or your trusted health professional, call Healthline and tell them that you're coming in. And the new things that have been introduced, like wearing masks in public, compulsory on public transport, but also really recommended now when we're inside and in spaces like supermarkets where we're in contact with other people.
And of course, gatherings. Our people love to gather, especially for things like church services, funerals, and weddings. What does level 3 mean for those occasions?
Yes, our communities have done so fantastic in this space. So impressive to see the online church services, and Pacific have been really at the forefront of the use of some of this technology. So again, church services are limited to being online. Of course, we will still have our funerals, and our hearts go out to people who are experiencing this at this time, but the funerals and weddings are now limited to numbers of 10. And we really understand why that is, because it is especially at these kinds of family gatherings where the virus gets to connect with us physically, because we're coming together and we're hugging and kissing. So limiting these numbers just for these next 3 days while government and the scientists are working out exactly what is going on here.
Now, with the Northland case, where there was a woman a couple of months ago now, many people panicked. They all hopped into their cars and they queued up, some for hours and hours to get tested. What is the testing regime with regard to Auckland this time round?
Yes, and we've been watching, those of us, we really feel for you in Auckland, watching the queues. There is no need to panic. Your news item had the information about Papatoetoe High School, where we know this young student attended. They're identifying what we call close contacts. And close contacts means that you've sat beside someone or they're living in your household. So it is these close contacts that we really need to get tested quickly. And so if we all go and get tested, even when we haven't been anywhere near them, we're actually preventing the people that must get tested. On the other hand, we also have what we call casual contacts. So we're getting all this new language. And casual contacts means that you may have been in the same place at the same time as someone who is infected. Now, the Ministry of Health have put on their website that long list of places where they were. So, for example, the McDonald's in Drury, and I think it was Bunnings. And so you can go on the Ministry of Health website and check these locations, but also really important to emphasize, it's only if you were there at the same time. If you went to that McDonald's at 5 o'clock in the evening and they were there at 10 o'clock, then you are not a casual contact. But if you have any doubts at all, call Healthline, call your GP clinic, and they will advise you about where to get tested. And the second really important information is, because we are hearing that this virus may be out there and may not necessarily be easy to connect to people we know, if you have symptoms, stay home, call and organize your test, and wait at home until you get your negative result. I think that is one of the most important messages.
Wonderful. Dr. Debbie Ryan, thank you so much for your time. And I know you're going to be back with us, with Brian in Pacific Days. Thank you for the work that you continue to do for our community. And we look forward to having a chat again in the not too distant future.
Mahalo whaafetai sui fua.
You're listening to Early Edition with Aotearoa. That is Dr. Debbie Ryan, part of the Ministry of Health Specialist Pacific COVID-19 response team, reminding us do not panic and to refer to the Ministry of Health's COVID-19 website for any additional information. The 0800 number, if you're not feeling well or if you're wanting to find out whether you should be tested or not, is, of course, 0800 358 5453.